The interesting thing about knees, I've broken my right knee twice, my left one once. But once I fell off a 3-story building, shattering my patella. And the second time, I fractured both tibia lengthways. So what's interesting, I want you to look at the structure of the knee. Now the knee doesn't work like a hinge. It works like a screw. So the inside part, and this is also called the medial aspect, moves twice as much as the one on the outside. Now this joint, just like all of the joints in the body, they're filled with fluid, okay, called synovial fluid. So the superfiltrated blood, so if blood's healthy, you get good fluid to the joint. If blood's not healthy, you get poor fluid to the joint. Now, every time you walk, your leg swings in the air, and what that does, that creates a negative pressure, okay, creating an increased production of the fluid in here. This is why when we have you do exercises in between the adjustments, we put a really heavy weight on your leg and have you swing your legs. It's a great way for knee rehab. Why? Because if we pull this apart, we're going to strain all of these ligaments inside. And you have ligaments on the back, ligaments on the front, ligaments on the side. But the main thing is when you create inflammation, the body builds it strong. Okay, now, since it moves twice as much, and this is taking the tibia and flattening it out, where it pivots on the outside, but it curves on the inside. So the inner part of the knee is totally different than the outer part. Now, there's a guide here called meniscus. And meniscus looks like Tupperware, looks like heavy plastic. And it helps guide the action of that femur unit. Now, the meniscus is connected to the ligament on the inside. It's not connected to the ligament on the outside because it moves twice as much. Now, meniscus is alive. In fact, all the structures in a knee are alive. Okay, so if I'm standing, there is a lot of pressure on this. Probably 80, 90 kilos on both, on these knees. If I stand on one, you're looking at, maybe 100 kilos on one pressure. So any blood vessels on this would be crushed. So it's called avascular, which means there's no blood vessels. It doesn't mean acellular, which means there's no cells. So all those cells are alive. They have to take in nutrients, produce proteins, and eliminate waste products. They do it through the fluid, synovial fluid, not through the blood supply. Now, the outside edge of this meniscus that holds this does have a blood supply. That's why it can be damaged and repaired very, very quickly. So, when we look, health of the blood is important. Distraction of the joint where you're pulling it apart is huge. And we tell people all the time to regenerate the meniscus, you have to pull it apart. And so we'll just have them distracted with the weight. But that's going to strain the ligaments and everything will work. Now, all the joints are hydraulic. They need fluid. So there's a pump in the back of the calf called the soleus. If that pump doesn't work right, the joints dry up. So that's important. Now the quadriceps, quad means four. So there's 4 muscles that attach to this bone here called a patella. We're only going to look at 2 of them. There's a muscle on the inside, a muscle on the outside. This is vastus medialis. Medial means the midline, okay, or middle. Okay, lateralis means the side or lateral, okay. So you got one muscle here, one muscle here that guides this kneecap or patella. And this is why if anyone does have a knee problem, I'm going to pull this one way to see if it causes pain. Because if this muscle's too weak, I'll pull it so far it causes pain. Or pull it this way, and if this muscle is weak, it'll cause pain. If both muscles are firing correctly, it's not a patellar tracking issue. Now, there's a ligament in here that crosses, okay? And when you say cross in Latin, it means cruciate. That's all it is. So these muscles limit the leg going forward or back. So it limits this thing from sliding forward or from sliding back. Now, a lot of people would get an MRI of a knee and they say, you tore the cruciate ligament. That means that this one is torn. Inflammation is distorted in the MRI. And it's so simple to see if this ligament is torn, where you literally grab this leg and pull it, and you pull this part forward, and if it doesn't pull forward, then the ligament's fine. If it does move forward, then it's not fine. If you push it back and it doesn't move, it's fine. If you push it back and it moves, it's not fine. So far, in probably 500 or 600 knee injuries where they said they had a torn cruciate ligament, I've never seen it torn. I think once, but even then you can fix it unless it's totally torn. And I'm talking super professional athlete. Okay, then foot biomechanics. Does that mean that if you're walking crooked that you're going to change the structure of the knee? Absolutely. Okay, and then patellar tractus. That's the laterals and medials. Now, trauma, compression. So if you damage this, okay, bam, that's going to strain or tear the ligaments. Now there's, it's called the terrible triad of Donahue. The way we're built, okay, and just think of this design. Outside, I can take a huge hit. Inside here, if I hit this, that's tender. All the blood vessels running there. Out here, I can take a huge hit. Inside here, you don't want to hit. So this is how we're designed to thrive on the planet. So we're designed to take a lot of impacts through here. Now, you've got muscles that hit here so the knee can bend, that's fine. You also have, it's going to stop it by hitting this knee. So our structure is really strong. The problem is if we go like this and hit it from here, that's unstable. Because remember, it moves twice as much on the inside. So hits from the outside of the body in can tear three structures. And it's called the terrible triad of Donahue. And it's the medial collateral ligament, bam, that tears. Then the medial meniscus, that tears. Then the anterior cruciate ligament, that tears. And that's super common in some aggressive sports. Okay, and even that can be corrected, a lot of times without surgery. Okay, now the meniscus, I found out after, because I've had 4 surgeries, I found out after the second surgery that you could regenerate. Okay, but I didn't know it at the time. Okay, it's just odd because the first surgery, they fixed my patella that was shattered. They just ground some bones in. That felt good. But then my knee hurt, okay, after I was hit by the car. And they did the same surgery. And I thought, it's got to feel better. It didn't. It actually felt unstable. And then, I went to the doctor, and guess what the doctor said? Another surgery, you'll be fine. So they did another surgery, this time on both legs again. And it felt okay, but it felt unstable. So then, what did the surgeon say? Did he recommend another surgery? You're right. So after the 4th surgery, it felt okay, but it felt really unstable. And then I started to think, every time you do a surgery, they're taking parts out, not putting stuff in. So it makes sense that it would feel unstable. So I thought, let me see if you can regenerate. Because if it's living tissue, we put it under a force load that forces that joint open. We look at the biomechanics, correct the calf, correct the feet, correct the nerve supply, stabilize the pelvis, do all the stuff that we do on everybody. And the knee can regenerate. And I always tell everyone, you can have a one knee symptom, never a one knee problem. Because if you're walking crooked because this hurts, does the other knee have to move twice as much? Absolutely. So you look at it as an alarm, not as the actual problem. That leg swelling, is that an alarm? Yeah, it is. It just means that we have to work the tissue, clean the blood, and the body regenerates itself. So any change in position from normal changes the input to the brain. This is what surgeons don't understand. I mean, God bless them, they're saving a lot of lives, but they're also doing surgeries without looking at what happens actually. If you replace a knee joint, you have less sensory input to the brain, so that's going to change how they walk. If you've had a knee problem in the past and you don't correct the pelvis, is that person who just had the knee operation going to have problems sleeping, digesting? Absolutely. We had a patient this morning who's the dad, okay, one of our patients, and we looked at his x-ray, and his x-ray kind of looked like this. So if I should be straight, and you're looking at me and I'm at an angle, am I in a relaxed state or a stressed state? So never having seen this guy, does he have good digestion or poor digestion? Good immune system or poor? Good sleep or poor sleep? Good regeneration? Have you heard me say this before? So how do you reverse heart disease? Get the balanced system and the body regenerates. How do you reverse cancer? Get the body, all of these diseases, they just go away. It's so weird. And you'll see it on all our testimonials. You'll see people with half a stroke, their faces, they couldn't speak, and then they're fine. Okay, so all of this stuff, people just regenerate. But you look at all of those problems as really alarms. Any questions about this? Was that good?
Yeah.
Okay, good. So Subri's at a rehab, fix the pelvis, stabilize the knee, correct all the mechanics. God bless you. Drop.